Good afternoon, Facebook. Thank you so much for tuning into Mayor Bowser's Maternal Monday series. I am Tiffany Wilson, Policy Analyst for Thrive by 5 DC. This week, Mayor Bowser will host the 4th Annual National Maternal and Infant Health Summit. On September 15th from 2 to 6 p.m., we'll hear from some phenomenal local and national experts about maternal and infant health innovation, reproductive justice, and exciting announcements about what's on the horizon in this space in DC. From 10 a.m. to 4 p.m. on Thursday, September 16th, we'll have virtual breakout sessions and our Health and Early Learning Expo. For more information about our 2-day event, please visit dcmaternalhealth.com. Today, I'm excited to be joined by 2 women dedicated to improving the lives of birthing people, babies, and families, both locally and nationally. And I'd like to pause to allow them to introduce themselves. Michelle?
Thank you so much, Tiffany. My name is Michelle Parrish, and I am a native Washingtonian, a parent of 2 children in Ward 5, ages 7 and 8. And I am so excited about the opportunity to converse today with you all. I am a community organizer, disability advocate here in the district, and do quite a bit of work in those arenas. And I'm so excited to be here today.
Thanks so much. I'm also so excited to be here today. My name is Jordan Downey. I'm an analyst at Surgo Ventures. So we are a nonprofit that works on solving health and social problems through data and behavioral science. And my background specifically is in community health, in public health, and in data science. And at Surgo, I work on our maternal health portfolio. So yeah, really excited to be here today.
Great, and thank you both so much for being here. Michelle, I'll start with you first. So we know that the summit is positioned as a national event, but there is a specific focus on highlighting resources available to district families. As a district resident and parent, can you talk a bit about your experiences with the summit over the past few years?
Oh my goodness. I get so excited when I think about the summit. I went to the very first summit, and in the initial portions of the segments, I had tears. It was just so moving to be a part of such a large and broad community of families, mothers, practitioners, community service members, all of that in the same room for the same purpose. It has had such a huge impact on my life as a mom, and it has prompted me really to be more active. That summit really pushed me into action. The very first summit pushed me into action as a community advocate, as someone with a child with a disability. And it's helped me to come to understand the various types of communities that are surrounding mothers, maternal health, and things that possibly could have been different in my life if I had a community like that at the time that my children were born. So it excites me greatly to see the summit come back this year. I'm so excited about there being some in-person activity, but I'm also excited to have the opportunity to expand the format to virtual as well. Which I know that the virtual format has allowed us to be able to reach more families to engage in the community. So the summit is my annual thing, and I cannot wait till next week. I am so excited.
Yeah, I mean, I could feel your passion talking about the summit. I know when we first met a few years ago, and I can honestly say that as someone who does not have children, it was hard for me to see my connection to this work, but it was the summit that showed me that as a community member, I also have a role in improving these maternal and infant health outcomes, and that is so important. So in addition
Absolutely.
to highlighting specific resources, the summit is an opportunity to highlight innovation and the value of cross-sector partnership and collaboration. So Jordan, can you share a bit more about Surgo Ventures and the work that's been done in the district?
Yeah, absolutely. So I'd love to tell you a little bit about a program we have called Rides for Moms, but I think before we jump into that, I think it's important to highlight some of the background and context as to why we designed this program the way we did. So we recognize that overall maternal health is not just determined by the healthcare you get in a hospital, right? A holistic view is really needed, including both those more traditional aspects of reproductive and maternal healthcare, but also factors related to where people live, where they work, where they play, where they raise their children. All those things also have an impact on health. So for example, can you actually even get to the care that you need, including prenatal care? So that's why we designed the Rights for Moms program, with the hypothesis that if we could provide a transportation option that was designed with the needs of patients and their families in mind, then maybe we could increase access to prenatal care and increase prenatal care attendance ultimately. So we're partnering with Uber to provide free rides to and from prenatal appointments at 2 federally qualified health centers in the DC area, Community of Hope and Mary's Center. And we're really excited. It's going really well so far. As of July, we have enrolled over 200 participants in the program. And we're finding that it is really serving the people who need it. Participants say that it's super helpful, that it's making their lives easier. So we'll have full results next summer, and we're really excited to share what we learned from the program. You know, we're really hoping that, this pilot in DC can really inform similar interventions, that it can become a model in other geographies where women might face barriers to accessing transportation.
Absolutely. I mean, it is so phenomenal that you all are partnering with those two organizations in particular. And I agree that DC is a model for resource sharing in so many ways. But thinking about this being an additional piece to support birthing folks getting to and from those prenatal appointments, which are so critical, is really great. So I do want to follow up with you, Jordan. At last year's summit, we discussed ways that the COVID-19 response could inform our efforts around maternal and infant health. How did the pandemic shape your work, specifically around the Maternal Vulnerability Index?
Yeah, so I think COVID really taught us that the impact of a pandemic on local communities is really complex and multifaceted. So one of our largest initiatives as an organization is something called the COVID Community Vulnerability Index, or the CCVI, which is an index that ranks US states and counties in terms of vulnerability to the pandemic. So when we say vulnerability, we're talking about those complex, multifaceted factors, all the negative ways in which a community could be impacted by the pandemic. So not just health-related impacts, but also economic, social, other kinds of negative consequences. And our work on that index did really inform our work on something called the Maternal Vulnerability Index, or the MVI, which is a new tool that we're launching this month. And it's very similar to the CCVI, but for maternal health. So it's an index that ranks US states and counties in terms of their vulnerability to poor maternal health outcomes. And it provides more complete local data than we've ever had about what makes people in the United States vulnerable to these poor outcomes. And every community is different, as you know, and the MVI really helps us better understand the different factors in a community that impact maternal health. So it has 6 themes. There are some themes that one might consider to be more traditional: maternal and reproductive health, mental health, general health, all the things that we think of traditionally as being involved in maternal health. But then there are also themes like socioeconomic determinants and physical environment. So we can see not only where, but why mothers are vulnerable to poor outcomes. So for example, a community with really high vulnerability in the physical environment theme might have really poor access to transportation, might be high pollution, might be severe housing problems, things like that. These are all things that we know affect maternal health, but they're kind of outside of the traditional sort of reproductive health sphere. And then lastly, it can help us better understand racial inequity in maternal health. So we know there are incredibly alarming disparities between severe maternal morbidity and mortality rates for specifically Black and Indigenous women compared to white women. And with the MVI, we can look at where risk factors for those poor outcomes might be different for different groups of people. And that helps us better target interventions that actually address the specific barriers that women of color are facing.
That's really great. I know the tool is launching this month, but I am really excited about this specifically because it can be an additional tool to support policy recommendations and decisions in the space, not just for DC, but across the country. I think a lot of our conversations around maternal and infant health We have like certain themes, and we imagine that those themes apply to every community across the country, and that is not the case. As I mentioned, DC is very resource rich, but we've also had folks engage with the summit who are from very rural areas, and those needs are very different. And I think that the MVI can really speak to that. So thank you so much for your work in that space. Michelle, I'll come back to you. So we know that in addition to the resource sharing and discussions about innovation, this is also an opportunity to advocate for proven maternal and infant health supports for families. As you mentioned, advocacy is something that you are quite familiar with. So can you share a bit about your disability advocacy work and its connection to maternal and infant health?
Absolutely. At the time that the initial summit occurred, I was fairly new as a mom. And my son was just starting to show signs of autism and related types of disabilities. And I was struggling to figure out what. And the summit encouraged me that what I could see was there were so many community members taking action for different things. And it opened my eyes to the possibility that I could advocate in an arena that met my personal needs. And so I began, initially learning as much as I could, and then connecting and tapping into the resources in the district. And I did discover that there was a necessity to create a better bridge to resources to families, because it was there are a lot of Black holes, there are a lot of long waits, and there's just a lot of frustration. So over the course of time, what we found was that we needed to make two connections. One was not only to baby through early intervention and school age supports and what they call age out supports for children who are over school age, who still require resources, but we also needed to protect the needs and interests of mom. And so while the work that we do is in that related to maternal in terms of prenatal maternal health, we really do focus and support in that postnatal maternal health, because what we find is that when you find that your child is going to evolve with a disability, it is a hard thing to process. It looks good on Instagram when you're showing up your positive, support, and you want to demonstrate what is exceptional about this beautiful child, but it is a hard road, and it's a very isolating road. And so what we discovered there was that that we really needed to dig in the postnatal piece to support families, provide early intervention supports, provide safe spaces for conversation, and also do the storytelling work that allows a family to understand that they themselves are actually not alone in any of the things that go on, that they will share experiences with other families, and you can be supported. We have found that there's significant value in collective mothering. Collective mothering has nothing to do with birth. Collective mothering is really a community way of raising children that is not new, especially around Black and brown moms. We've been doing that forever, and it continues to be done. But we found that we needed to create that power in our niche, where it was a specific community of moms who came together to collectively raise our children. It makes a difference when you have someone that you can take your child's over, take your autistic son to their house, and they can still have a play date and nothing will be out of the ordinary. It makes a difference when you have those safe spaces, but also where you can cry and have some conversation. So that's the work, that we've been doing in advocacy and our connection to maternal care. The early intervention work is definitely helpful, but a lot of this we just don't know until baby arrives. And a lot of the postnatal care forgets that there's a space here for mom that really matters and makes a difference in the ability for the child to fully thrive once we make this diagnosis, and we all need to collectively move forward. That postnatal assistance in that arena is really huge, and it's often forgotten, but we're advocating for it.
Absolutely. And I think one of the things you mentioned just made a connection for me, right? We have conversations about, um, birthing people not being listened to, right? When they're in these conversations with their providers. I know we talk about a lot of high profile, celebrities who've experienced similar things, where they felt like they couldn't advocate for themselves during pregnancy. But there's also a piece here about knowing how to advocate for yourself and your child's, um, once you, as a parent, can recognize that something is not right, right?
Absolutely.
It's
Absolutely.
not having someone tell you, oh, all babies are different and you just need to wait. It's
Yep.
trusting yourself and your intuition and being able to communicate to the provider what your needs are and what your child's needs are, because you don't want to wait until something becomes a bigger problem, especially when
Absolutely.
we have resources, that are available to speak to that. Um,
Absolutely.
One other piece you mentioned here is just this idea of, um, you know, parenting being an isolating experience. As I shared, I am not a parent. I can only imagine what it is like to be a parent, especially now, and as we're still in the COVID-19 pandemic. Um, but as an individual, I mean, I can speak to how isolating things have been for me over the past, year and a half, um, and just thinking about what that's been like for an already isolating experience, to add COVID on top of that, and then not have the points of connection, to talk about how things have been hard for you specifically, and not in this general sense, that, oh, things are hard for everybody. No, it is. There's a very
Yeah.
specific thing that I'm experiencing that folks cannot relate to. So I think it's great that you raised that. And it reminds me to mention that, at this year's summit, we will have community spaces,
Absolutely.
at the end of the day, where folks um, who share a certain identity will be able to come together and have those conversations, attendee to attendee. It will not be a time where you have to sit and get information. You won't have to listen to folks necessarily talk from a panel, but you can connect with other, attendees who are experiencing the things you experience. So we can move from that isolating feeling to the collective, that collective mothering model that you mentioned, Michelle. So I really
Absolutely.
appreciate, your expertise and your focus in this space, and how you challenged us to ensure that we're raising that up, within this maternal and infant health work. So, I really appreciate you both for being here today. But before we wrap, I want to ask what you're most looking forward to at this year's summit.
I am, first of all, looking very much forward to being in person. There's a power in that feeling of being in the room that it's just unmatched, and so I'm looking forward to that. I do believe that the community spaces and the affinity spaces this year are really tapping into the personal needs and direct personal needs of the community, and so I'm really looking forward to hearing more about in those spaces where we can learn more about the various different unique things that are happening in the community that really do touch on a very broad spectrum of maternal and infant needs this year. More so than it's more expansive, I think, this year than what we've had in past years. So that's exciting for me.
Yeah, I think similarly, I'm just so excited to be in person as well. I think in an academic sense, I'm really excited about all the sessions that will explore those more community level determinants of maternal health that we may not think of as traditional health indicators, like housing, for example. But then on a more personal level, I'm just really excited to be in person and to actually meet people in person and connect with people who are doing really interesting work in maternal health. And I can't wait.
That's fantastic. And, Jordan, I'll start with you. Can you share how viewers can learn more about your work?
Yes, so there will be a link to the actual MVI website on the resources page for the summit. So if you go there, you can actually look through the tool yourself. You can play around with it. And then, of course, if you're interested in working with us, if you see the tool and you play with it and you think like, wow, this could be really interesting for my organization, definitely please reach out, get in touch. We would love to hear from you.
And well, for me, first, you can register for the community space for disabilities and families on the live day. We'll be facilitating storytelling in that room. And I would love for families to join us and share those stories and find a bond with another community member where they will learn that they are not alone on the journey, but also you can find more about our work and where we'll be and our conversations at WeTheMotherhood.com.
Okay, yeah, and I'll be sure to put both of those links in the description so folks can access those. Michelle and Jordan, I really want to thank you both for taking part in today's segment. Of course, we thank Mayor Bowser for the annual convening and the continued investments made to prioritize the health of district birthing people and their families. So to our audience, thank you so much for joining us today. Join us on the first Monday of every month at 3 p.m. right here on the Mom Health DC Facebook page. And don't forget to join us for the Mayor's 4th Annual National Maternal and Infant Health Summit this Wednesday and Thursday. To learn more about this year's event and to register, please visit dcmaternalhealth.com. We'll see you at the summit. Take care.